Hi, and welcome to the How to Survive Healthcare podcast. I'm your host, Kayla Thompson-Riviere, seasoned critical care RN turned independent patient advocate. Tune in every week so that you can learn the things about the U.S. healthcare system that no one ever tells you. That way that you can get the most from it and optimize your health outcomes. Now, of course, this podcast is strictly to inform and entertain and should never be taken as a substitute for medical advice. Let's dive right in. Hello, and welcome back to another episode of How to Survive Healthcare. I have a special guest with me today. Today we have Miss Lorrie Klemons. Lorrie, tell us a little bit about yourself.
Well, I have been a nurse since 1972. As a very young nurse working at Bellevue Hospital in New York City, we took care of a lot of indigent patients who were foreign, didn't speak the language, had mental health issues, were homeless, alcoholics, and somehow they all ended up being admitted to Bellevue through our emergency room. But early on, as a young nurse, I realized that these patients had no voice. They had nobody to advocate for them. Nobody really listened to them. And it sent me on a 52 plus year career of being impassioned about making sure every healthcare consumer had a voice. And because
Certainly giving a voice to the voiceless has also been a background of my nursing career. But you were starting that trend before me, so thank you.
Probably before you were born.
Yep. So, Lorrie, what are you up to nowadays?
Well, nowadays I left my home after New York. I had my kids in New York and then raised them in Charlotte, North Carolina for 35 years and had a business called Klemons Healthcare Consulting. My business was to make sure every patient, senior caregiver had a voice in any healthcare setting. And since that time, I have become end-of-life death doula and also a certified dementia practitioner, which gives me those extra special skills and expertise to meet all my patients' needs, all my clients' needs. And I moved to Madison, Wisconsin 3 years ago, full-time from Charlotte, North Carolina, and to enjoy aging with my husband. And I have a married son here and two adorable grandkids. And I thought I would do him a favor and not be a solo ager in Charlotte, but Madison, Wisconsin. So in case I needed him to advocate for me, it would be easier for him.
Yeah, that's awesome. And speaking of solo agers, that brings us to our topic here today. Miss Lorrie is going to share with us from her experience some of the top things, kind of in a nutshell, every solo ager needs to know when thinking and planning for their future. So take it away, Lorrie.
Well, I'm assuming that everybody knows what the term solo ager means.
Thank you.
So it's, in Charlotte, our senior care industry referred to them as senior orphans, which I never really liked the term orphans, but there are seniors who find themselves aging and without family or without family in the town where they live. And so they don't have that family level of support. And as we age, we all will come to, even young people. My 32-year-old son was very sick back in 2016, and I went to New York for a weekend to see what was going on with his headaches. And I ended up spending 9 months with him. We nearly lost him. He was very sick, but there were times that he did not have a voice, and that's what my role was, to be his voice, speaking for him, not for me, but for him,
Right.
when he lost his voice. So you don't have to be young to lose your voice. So as we age, particularly, some of you seniors who are listening right now may have noticed that as your hair gets gray, as you need a cane, as you need a walker, that you don't feel quite as confident, you don't feel quite as valued. And unfortunately, in our society, getting old does not mean you're getting wiser. It means sometimes that you're getting weaker, less vulnerable, losing your voice. And I'm here today to talk to you about how you can keep your voice for as long as possible, but appreciate that there are times when you won't have a voice and that you need to make sure you have a patient advocate advocating for you. And
Absolutely.
It doesn't need to be a friend. It could be a clergy, a trusted friend, an attorney who you trust, a doctor who you trust. But there will be times when you need to have an advocate. And before you're in crisis, you should make sure you have one. And maybe you have a single friend who's living alone and who also is a solo ager, and maybe you can agree to be each other's advocates. And it doesn't take a lot of work. It just takes a passion and caring about another person. And truly, you're not making decisions for that other person when you advocate for them. What you're doing is making sure whatever the person you're advocating for, that you know what their wishes are and that you can speak, be their voice, not your own voice, but be their voice when they or you lose your voice.
Absolutely. Lorrie, what are some common times or instances that our senior population tends to go through where they'll be in a position where they're not able to use their voice? And just so we're clear, people, we're not talking about, these are not times where you get laryngitis. These are just situations where you're in where you are either physically or mentally unable to speak on your behalf.
One of the ones that everybody needs to know about is that the minute you become cognitively impaired, you are no longer legally able to sign any legal documents. I encourage people, because they predict by 2050 there will be over 50 million people with dementia. They are working on cures, but right now the numbers keep increasing. So particularly before you're in crisis, make sure that you have all your legal documents in place. You've heard the term advance directive. Those include having a living will. Those include having a medical power of attorney. Those include having a durable or what we call fiduciary power of attorney, and also a will. And a medical power of attorney is really important because this is a person who will speak for you and be your voice when you have a medical issue. A will is where you will leave your assets to. And that's very important to have a will. And keep in mind that with wills, there's no guarantee that they won't go to probate, which will cost your beneficiaries time and money. A fiduciary or durable power of attorney is the person who can write checks for you or pay your bills when you might not be able to pay your bills because both of your hands are in casts and you can't write checks, or you're confused and you miss a bill payment. So those powers of attorney, two powers of attorney, are really important. And then the living will is something that you fill out where you determine what kind of care you want at end of life, what kind of care you want them to pursue, and what kind of care you don't want them to pursue. And those documents should become part of your medical record. And you should speak to your doctors about how you make those documents part of your medical records, because that will make sure that you have a voice when you don't have a voice. So with that being said, when might you lose your voice? Number one, if you're having a medical or diagnostic procedure for which you're going to be sedated, you lose your voice. If the doctor goes in to do a colonoscopy and sees that you have a polyp and he has to remove it and there's bleeding and they have to rush you to the operating room, you need to have an advocate. If you're taking medication that could cause a little confusion or disorientation, or a sleeping pill, you may lose your voice. You will lose your voice if you are on a ventilator in the intensive care unit or you're in a coma. You will lose your voice if you're in a foreign country and you don't speak the language and you have to be hospitalized. You lose your voice. So there are many times where you might lose your voice. If you have hearing aids and they're not working and you can't hear what somebody's asking you, you've lost your voice because you can't speak, you can't respond to them.
Right. And I think that the takeaway here is that though some of those things are things we can plan for, like the colonoscopy, some of those things we can't. For instance, ending up on a ventilator. I mean, there's a whole laundry list of things that could lead to that. So that just really underscores the importance of finding your advocate and your decision maker now. Really, there yesterday, but since we can't go back, let's have that conversation now and start figuring these things out, because the last thing anybody would want is for you to become a ward of the state and appointed somebody who does not know you, doesn't know your wishes, and is really just left to guess about what might be the proper care for you. Often those people are also overwhelmed with too many people that they are trying to care for, and just not a road we want to go down. So consider this your sign.
Right. And also, just if you're anxious about something, or you're in pain, or you're scared, you sometimes lose your voice because you don't speak what you're really feeling, and it impacts your communicating with other people.
Absolutely.
And there's research that shows once you put on a hospital gown, whether it's at the doctor's office or going for x-ray or in the hospital, we lose 30% of our communication skills by being embarrassed, feeling vulnerable and weak in a hospital gown while everybody else is dressed.
Sure. Yeah, you're already put into a state of,
right.
There's this power balance and you feel disempowered, and it can be very difficult to reclaim that, especially in a setting where you're not feeling well. Now, how are you supposed to, if you have an illness that's twice as bad as that, 5 times as bad as that, how are you supposed to stand there, use all of your critical thinking, and make sure that you're advocating for your every need? You can't. You simply cannot.
Right.
That is why it is so important to have somebody, as you said, if it's not a family member, a friend, or even a professional advocate like ourselves, to really be able to be your very strong, powerful, fully clothed voice.
And I will tell you, I'm dealing with a client now in Charlotte that was diagnosed with dementia. She's divorced. She has a 38-year-old son who's totally incapable of doing anything emotionally and physically. He just doesn't know how to help her as much as I've tried. She has now reached a state where she is unsafe to live alone. She has no resources. And I've been talking to the son and her ex-husband, who really doesn't want to have anything to do with her, but he has compassion for her, talking about her becoming a guardian of the state because she has nobody, she has no family, and you can't expect a friend to do that for you. So it's a very difficult situation. And I would tell the listeners out there that if you have people in your life that you love, it doesn't have to be family, it could be friends, and you trust them, if they tell you that your behavior's been a little bit off, your memory's been a little bit off, the average person, the normal reaction would be to say, oh, you don't know what you're talking about. And people get very defensive. But trust me, the best response, if somebody you care about and trust tells you that, is to say, thank you for sharing that with me. Would you be willing to come to my doctor with me and share those observations with my doctor? Because, we don't have cures for every disease, but we can certainly slow down disease process and give you better quality of life.
Absolutely.
And
yeah, there's some exciting new drugs coming out to try to stall. Again, it doesn't stop it, but it does buy you more time.
Right. And maybe one day we'll have a cure. So even with the, breast, if you feel a lump in your breast, you don't ignore it. You go to the doctors,
Right.
because we know that early detection and early diagnosis makes for a much better, higher cure rate and gives you a better quality and quantity of life. So I always tell my seniors, if you can't find your car keys, that's okay, but if you're holding them in your hand and you don't know what to do with them, you have a problem.
Right.
And at that point, if you don't know what to do with keys, then you might have some cognitive decline. And again, legally, you're not allowed to sign any legal documents if you have cognitive decline. So just keep that in mind. But I'm very big for being proactive because the years fly by, as we all know. Kayla has an infant baby. I remember those days. And now my kids are 41 and 44, and I'm on Medicare and Social Security. Retirement comes in the blink of an eye, and you have to be proactive and you have to plan for things, because once you're in crisis, that's not the time to plan for things. Somebody else is going to be making all the decisions for you, and it may not be the decisions that you would have made for yourself if you had been proactive and done it in advance.
Now, speaking on that, you said that you have a client who is becoming unsafe at home. What are some things that our solo agers listening can do to stay safe in the home as long as possible?
Well, there are several things you can do. One of the big ones, and it's not expensive, is to get a medical alert system in your house if you live alone. If you live with somebody else, it's not that important. But my husband and I are in our 70s, and for years I've been telling my husband, if I predecease you, make sure you get a medical alert system in the house, because just because you're young and ambulatory and are healthy doesn't mean that you might not pass out one day or fall and break your hip and not be able to get to the phone. So having a medical alert system is really important in your house. And you're talking about an initial investment of maybe $100 and then maybe $20 a month. So we're not talking about lots of money, but it really is important. You can just Google the top home medical alert systems, and that will give you a lot of confidence to know that if you should fall or pass out, that help will be sent your way.
Sure. And I would add on, even you mentioned, especially for solo agers, and maybe not as important for people who live with somebody. But I would add on, if that somebody is frequently gone for more than 2 hours at a time during the day, you really should consider also having one, even though at some point they will come back home. How long do you want to lay on the floor with a broken hip? Because not only is that painful, but speaking from an ER nurse perspective, it actually, the longer you are in a state where you can't get up, can't take care of yourself, something has happened, even if it's not a fall and a busted hip. There's a lot of other body processes that begin to malfunction, and it creates a whole sequela of events. So whenever something like that does happen, it's really important to get care as timely as possible. So that's just my plug. Even if you do live with someone, if they, especially if they still work or something, get yourself that medic alert system.
Yeah. My mother-in-law broke and fell and broke her hip and laid for 8 hours
Oh
until
my gosh.
found her. Yeah. So you don't want that to happen to you. So a medical alert system. And the other thing I want to say before I forget, for seniors, if you look up your local, the county you live in, if you Google or just look up your Department of Social Services for Seniors or your Agency on Aging in your locality, very often there's grant money and there are systems and programs in place in your local community that will help you age in place safely. Because everybody wants to age in place, but you can only do that if you can do it safely with joy and dignity. And so that's plan A. And you have to plan for aging in place. You know, maybe you bring somebody in from a advocacy or nursing agency or Department of, Aging on council on aging, have them do a risk assessment in your house to get rid of the loose area rugs that you could fall on, to help you make your house safer for aging in place. There are a lot of services that are provided by your county.
Right.
The other thing that will help you age in place as a solo ager is to make sure that you can take your medication safely. And a lot of pharmacies now pre-pack your medications in individual packages with the time and the date and the day on it. But you can certainly research, talk to your own physician about the best way and the safest way for you to take medications so you don't overdose, skip a dose, can't remember, did I take my dose
Right.
or did I not? Because you can get very, very sick by overdosing or underdosing if your disease or your condition is not being maintained and treated well. But I would talk to your local pharmacist, because they often can make recommendations on devices in your home that actually talk to you and say, okay, Lorrie, it's time for your 10 a.m. and actually dispense them. Those kind of devices are more expensive, but they do exist.
Sure.
So it depends on what your budget is and what your resources are. But
Absolutely.
taking your medications safely is very, very important to keeping you empowered, keeping you with your voice, and making sure your voice is heard.
Now, you mentioned aging in place as plan A, but really there's 4 pieces of the plan for our care as we age, which I just want to say, we need to plan for care as we age, because as much as we'd all love to pretend that we won't need some sort of assistance, we very much will. Unless tragedy strikes, most people come in the world needing a great deal of assistance and go through a similar process towards the end. So will you briefly go over the four aspects of our care as we age?
Okay, so I just did want to say one thing about the advanced directives, that you could speak to your personal attorney about how you get them, or you can talk to a attorney that specializes in senior elder care attorneys, and they will help you create the resources that you need for the advanced directive. So Plan A, we already touched on, is planning to age in place with joy and dignity and safety, very important. And maybe that means an elevated toilet seat. Maybe that means some medication devices to make sure you're taking your meds safely. Maybe that means a medical alert system, but being able to age in place. And Plan B is, what happens if you break your hip and you go to rehab and now you're coming home and you need help? So do you have the resources, let me just say the dollars to bring in an aide part-time? Okay, it could be
right, because guys, Medicare doesn't cover these things.
Right. Now, if you're on Medicaid, that's a different story, but Medicare doesn't cover home health aid. If you needed a nurse, they would, but at that point, you don't need a nurse unless you need nursing or medical procedures. You don't need a nurse, and they won't send a nurse. But a home health aide, can you afford at $35 an hour to have a home health aide in your home for a couple hours a day to help you with those urgent needs that you might have? Plan C is planning the dollars to what if you need help full time and you want to stay at home. And that could be $13,000 a month out of pocket because Medicare doesn't pay for it. And then Plan D is what would happen if you couldn't stay home at all, even with full-time help, because if your condition deteriorates, one person cannot possibly meet all of your needs at home. They would need supplies and equipment. So you'd need to go into assisted living or memory care. And those are very pricey monthly expenses. And if you don't have long-term care insurance, it's all out of pocket. So what I'm saying is you should be talking in advance before there's a crisis. Meet with a financial advisor who specializes in retirement and end-of-life care so they can help you plan for this. Not all of us are rich. Not all of us have rich kids that are going to help us. And we have to use our voice while we can to make sure that we have everything set in motion so we can be taken care of ultimately at the end of life. My mother passed away from natural causes at 99 and a half.
Woo!
Yeah. I hope I inherited her longevity.
I hope so too.
Yes.
And as you were mentioning that planning for all of those dollars, you also don't want to be in a position where you're forced to spend all of your retirement savings that you were hoping to pass on to your children. So it does vary state by state, but typically if you start planning this money 5 to 7 years of advance of care actually being needed, there are more things that the attorneys can help you to do to protect more of your assets than if you are waiting till you're in crisis. So 5 to 7 years before you even need care, depending on your state, is going to be the minimum for getting these things set up. So like I said, yesterday was the time, but in lieu of that, now is the time. The elder care lawyer can help you with setting up for those care plans A, B, C, and D, and also with the advanced directives that we had mentioned earlier. So, Lorrie, this was a great nutshell of things that solo agers need to be aware of. If somebody has specific questions to you and wants to reach out to you, what's the best way to get a hold of you?
Through my website, which is Klemons Healthcare Consulting. Do you want Klemons is spelled K? It's the fruit lemons with a K. So
I love that. And we'll link it in the show notes as well.
Klemons Healthcare Consulting. There is a form where you can reach out and contact me, and I will be happy to get back to you in a timely fashion. I also have blogs on my website. If you just click on the blog section, I write a blog every month, and I'm happy to share them for free.
Perfect. And for more information on some of the advanced care planning aspects, we do have other episodes of that earlier on in the podcast. So I'll link those in the show notes as well for some more information on that. Well, thank you so much for being here with us today, Lorrie. I really appreciate your time, and I know this will be an incredible resource to our community. Thank you, and I will see you all next Monday. Take care.